evening, everyone. It's Dr. Lisa. Welcome to Straight Talk with Dr. Lisa. I bring it to you straight, no chaser. We are so happy to have with us today Dr. Susie O'Mara. She is an emergency room doctor here in Washington, D.C. She's also a member of the Grapevine Health Speaker Bureau. If you are not familiar with Grapevine Health, you can find us on YouTube, Instagram, and Facebook at Grapevine Health, or on Twitter at Health Grapevine, or you can just go to our website, grapevinehealth.com. And you'll see Dr. Susie there in our speaker bureau. So how are you, Dr. Susie? Welcome.
I'm all right. I'm all right. Busy time here in the emergency department. My mom is sick. She's actually in the ICU, so that's preoccupying me a little bit. So I'm a half family member, half doctor at the moment.
Yeah, well, thank you for making the time to join us during such a difficult time. But I know people will appreciate hearing from you. And we wish the best to your mom and your family.
Thank you so much.
So tell us a little bit about, well, first, before I ask about the ED, the emergency room, I want to just hear from you. Why did you become an emergency room doctor? There's so many different specialties you could have chosen. What's so special about ER?
Well, I think there's two levels to that. The one level is when I went through medical school. Well, the reason I went to medical school, I wasn't ever planning to go to medical school. I was going to be a journalist. I was going to be this. I was going to be that. I was going to be a lottery winner. I had many ideas for my career. And then I went out and started working, and I thought, oh, I got to do something really interesting like this. But my first job was not in any way interesting. I was fundraising for a college, and I said, well, I got to just go out and talk to people. And I realized, oh my gosh, I could be a doctor. Like I met somebody who was doing that, and I thought, oh my gosh, I missed the boat in college, but I could go back and do it all. And so that's what I did. I went back and took all my pre-med classes. That's when I went to be a doctor, because I just thought, well, that doesn't sound like work. That sounds like fun. That sounds interesting.
Really?
Yeah. Well, yeah. What did I know? But then emergency medicine, what happened was every rotation I did in the hospital, surgery, psychiatry, radiology, every little thing I did, I was like, well, this is good. Well, this is good. I want to do that. I want to do that. And it turns out in the emergency room, you do some of everything. The other thing that I realized when I did a rotation, I spent a month in the emergency room. I realized that the people in the emergency room really need a connection, like an immediate connection, because it's a really, really hard, stressful time in life. And it just really spoke to me that was something that I could help people with. And I thought, well, what more important thing to help people with than like the most, one of the most stressful moments of their lives. And that's why I decided to do it.
You're one of the first people I've ever heard say you didn't think it was a lot of work to become a doctor or to be a doctor. So that's really an interesting perspective.
It turned out to be a lot of work. But when I was thinking about what you did with your day, like what you do on a shift, what you do in the hospital, I thought, well, that doesn't sound like work. That's just running around talking to people and doing things with your hands and helping people. And that didn't like work. I thought of work as like sitting in the office, doing the emails, working on process improvement. And when I thought about, no, I could be a doctor and just run around and talk to just regular people every day. Who need help, who need this or that, and then I provide that help, and then they're better, or not, but I could still help them. Anyway, just spoke to me.
Yeah. So tell us about one of your most memorable moments as an emergency room doctor.
Well, it's kind of a deep one. I was working in a very small emergency room in a very small hospital, and a very elderly woman came in, and she had bleeding in her brain. A sudden ruptured blood vessel. And she came in so sick. We had to put her on life support. And we had to send her to another hospital, to the hospital I work now, as a matter of fact. And about an hour after she came in and we were getting her ready to go and getting her ready, the helicopter was on its way, her husband came in because he got chest pain because he was so worried about her. And her husband came in and he was okay and his vital signs were good and his wife was all ready to go. And we just were talking to him, and he said, well, is she going to live? And we had to tell him, probably not. It's really very serious. And she wheeled past his room out to the helicopter pad, and I was just happened to be sitting at the bedside talking to him. He was in the Navy back in the day, was talking. And all of a sudden he just went into cardiac arrest. And he was a person who didn't want to be resuscitated. We knew that already from his records and everything. And yeah. And when I called his doctor, he said, I'm not surprised. He said, they're just like that. He said he could never live without her. Oh, it still gives me a chill.
Wow.
So, yeah. Isn't that incredible?
That is. I've heard stories though about people who've been married for a really long time, and once one spouse dies, the other one dies within 2 or 3 weeks of their death.
Yeah. I had heard that too, but I really drove it home. Yeah.
Wow. Yeah. So one of the things I would love to hear your perspective on is people using the emergency department. And pre-COVID, like before the pandemic, this was a huge issue with people using the emergency room. They're crowded a lot. They either do or don't have healthcare providers. A lot of people go to the emergency room even though they have a doctor. So why do you think that's happening? Or we can talk about what's happening, during the pandemic. I know it's different.
Yeah.
But before, like what's going on there that people prefer the ER over their doctors?
Well, I honestly don't blame them. I think that, when you try to navigate, so even the people with the most resources, the most help, the most this, that, the best computer, the best internet, the best email, whatever, it's almost impossible to navigate the medical system. And even when you do enter the process, say, okay, you need to go to your doctor. Okay, so you call. Well, we got an opening in 2 weeks. Well, my problem is right now. Like, what am I supposed to do now? So say they did have an opening. You go in. Okay, well, you need some blood work. Well, you got to go over the other building on another day with this form and get the blood work. And then about a week from then, we're going to get the blood back. And you got to come back and talk about that. Oh, and now you're going to need an x-ray. So where are you going to go for that? It's incredibly inefficient. I mean, I don't blame people. You come to the emergency room, and yes, you wait, which I'm sure we'll talk about. You wait. But on the other hand, 4 or 5 hours, all those pieces are done. We have radiology, we have blood work, we have the doctor, we have the nurse, we can call the ENT, we can call the specialist, so it's, I think the system creates a need to have a more efficient option, and then people choose it. It's just natural forces. I would choose it too.
Yeah. I want to invite, I'm just going to take a second to invite those who are listening or watching right now. If you have questions for Dr. Susie, put them in the chat so that we can ask her your questions. And I'll tell you, Dr. Susie will also give it to you straight, no chaser. So if you have questions about how the ER operates or anything you want to know, just put it in the chat and we'll ask her. So Dr. Susie, let's talk about the pandemic. And I know the emergency room situation has completely changed during the pandemic. So tell us about that. What's different?
Wow. We're getting back to a little bit of a normal feel now. Luckily, our numbers in DC are going down a bit. When COVID was quite severe, and our COVID numbers at my hospital were very high, the ER was really different. The sickest patients were coming. We weren't getting a lot of less sick people. Sometimes that's bad. Sometimes people with chest pain were staying home. People with strokes were staying home. They were afraid to come to the emergency room, so it was a bad thing. But we were getting a lot of very, very sick patients and doing a lot of critical care and having each person to have their own room. And it was really it was a busy time, super critical patients. But the beauty of it was that the whole hospital had to orient to those sickest patients. Everybody was aware that we were in a very special, very critical time, and like moving patients fast and getting tests done fast, and trying to just take care of the sickest patients as fast and best as we could. So it was actually really inspiring too, because I just saw all my staff members, all my colleagues, everybody. It was a dangerous time for all of us because we didn't know. We didn't know PPE worked or not. Now we know it works. Now we're comfortable. But at the time, it was uncomfortable, worrisome.
Yeah.
Just put on all that gear and go on in and just do your job. it was a nerve-wracking time, but nobody ever said like, I'm not doing it. Not me, too unsafe. Nobody said that. Everybody just carried on. So it was kind of an inspirational time. And now we just have our protocols in place. People sit 6 feet apart. People, we test everybody for COVID because they might be admitted to the hospital. Everyone has to have a COVID test. So we have our processes, and it feels kind of second nature now. But
do you think we'll ever get back to the old way it was in the ER?
Well, yes, I do. Because what we're seeing too, I think, is that people coming, we just looked at our numbers actually, and people are still coming to the emergency room and they've come back. They're starting to come back with.
They're more comfortable now.
Yeah, people are comfortable. And you know why? Because masks work. In DC, people wear their masks. And I think people are realizing that they wear their mask and they stay safe and they can come get the right care. Get care they need. It's a good thing. Wow.
So what do you think was happening to all those people who were having strokes and heart attacks and not coming to the ER?
That's a big mystery. I think, unfortunately, what happened to some of them is that they came, but they came later. So in other words, they waited till their stroke was like full blown, or they waited till their heart attack was like really critical. And then they had no choice but to come. So I do think that those sickest people did end up coming, or, unfortunately, perhaps having, not making it to the hospital.
Yeah.
I do think that happened.
Yeah.
They're really starting to look at that and try to figure that out.
Yeah. So one of the things we want to do on Straight Talk with Dr. Lisa is also educate people about certain aspects of healthcare. And I think one of the things that confuses people is when they should actually go to the emergency room. Because a lot of people, again, pre-pandemic, and maybe now you're seeing this more, a lot of people go to the emergency room for things that are not really an emergency. But if you ask a person, well, is it an emergency? Well, it is to me.
Yeah. Yeah.
How do we help people determine what's appropriate for the emergency room and what's not?
That's a question for the agent, Lisa. And I think one thing we have to include in the conversation about that is that DC particularly has a lot of urgent care centers where patients go.
Not east of the river.
That's true. Just right. And so the calculation is a tough one. Technically speaking, the textbook idea of an emergency room is that if you think that if nothing if somebody doesn't turn around your situation in a matter of minutes to hours, that you're going to lose your life, you're going to lose your breath, you're going to lose a limb. And that is a pretty high bar. And that's asking a lot of people to stay home with, severe abdominal pain and say, well, it's not going to kill me, so I'm not going to go to the emergency room. It's just ridiculous. I think it doesn't really hold up. So I would say severe pain is a reason to go to the emergency room because no one should tolerate severe pain. Shortness of breath, like trouble with life-sustaining things like breathing, alertness, like if there's something wrong with how, like if somebody passes out, if somebody feels so dizzy they can't stand, something's wrong with your brain, it's not working right, that's a reason to come to the emergency room. Chest pain is always a reason to come to the emergency room because you don't know what's from and it's really hard to tell if you're hard or not. So breathing, chest pain, severe pain of any kind, blood coming from somewhere where it's not supposed to come from. You're vomiting blood, you're pooping blood, blood's coming out in your urine, like somewhere where blood does not belong coming out of your body. Another reason to come to the emergency room. And then high fever, especially in adults. High fevers in adults, fevers, shaking, chills. That's something that could be mild and it could be severe. We just, it's hard to tell by experiencing it.
Yeah.
So that's another good reason to come.
Cool. Well, we have a question for you here, Doc. First of all, I'm looking at the chat and maybe you're a celebrity and don't know it. So there's someone here who says, Dr. Omara, I love her. She is awesome. So you definitely have some fans out there. And then someone's relating to your story about the couple Cynthia says, yes, my mom died. Then 5 days later, her dad died. They were married 61 years. So there is something to that, right? I think there's a symbiosis. Like people are connected. It's like a part of you.
Yeah.
It's
It
really,
shows
really.
there's that spiritual piece that we can't understand, you know?
Yeah. And then finally, hi, Deandra's joined us. Before we introduce
Hello.
Deandra, there is a question here for you, Dr. Susie.
Okay.
What can you say to those of us who are leery about taking the vaccine? Some of those vaccines have harsh side effects.
Yeah. Well, first of all, I want to say that, like, I respect everybody's concerns. I mean, because you're concerned about your body makes a lot of sense, right? You should be as cautious as you can be. I'll also say I'm very gung-ho the vaccine. Like, emergency department, we were lucky enough to go early. I couldn't wait to get in there, get my vaccine. And the side effects that we're seeing are side effects that are like discomfort. Luckily, we haven't seen side effects that are dangerous. So there are some people, so the arm sore, like most people get that. Some body aches, most people get that, especially after number 2. Some fevers, you feel kind of miserable for about 24, 36 hours even. There's some misery in there. But the thing I like to look at is danger. Is it a side effect that's dangerous or just like really uncomfortable? Because having seen as many people as I have who have died of COVID or been on a ventilator with COVID, I'm like, you know what? I would take 36 hours of kind of a lot of misery if it guaranteed me that I wasn't going to be on a ventilator or die of COVID.
Yeah.
That's just that's like where it all comes down to is that point. So that's my thought.
Yeah. I was in the Moderna vaccine trial, and I ended up getting the vaccine, but I had no side effects. It was very unpleasant, but in less than 12 hours, it was gone. And then I didn't worry about getting COVID again. So
it is I think it's important to mention it's a hugely liberating feeling to be vaccinated, to be like on the other side of the discomfort, right? To come through it and be like, I am vaccinated. I am not in danger. Like, we've lived with that feeling of being in danger for so long. It's like exhausting. You don't even realize how exhausting it is to feel like you're constantly at risk.
Yeah.
And to have that lifted is a great feeling that I strongly recommend.
Yep. And there are a few other questions here about the whether or not people should take the vaccine. And I'll just take that quickly as an infectious disease doc who understands a lot about these vaccines. I think it's important to take the vaccines if you are someone who's at risk for COVID-19 for the reasons Dr. Susie just expressed. All the death and dying she's seeing in the emergency room, even among people who have underlying health conditions or who might consider themselves to have weaker immune systems, that also places you at risk for severe COVID hospitalization or dying. And I think getting the vaccine makes a lot of sense. So, Deandra, welcome to the show.
Hello. Hey, Dr. Susie. Hey, Dr. Lisa.
Yeah. So, one of the unique features, I'm proud to say, with Straight Talk with Dr. Lisa is that I love for people to ask their own questions. Instead of just having conversations between, colleagues, doctor to doctor, or expert to expert, because sometimes things get lost in translation, and it also adds a little, different flavor. So thank you so much for coming on. I'll just briefly introduce you. You are a community health worker, so you are someone who's on the ground talking to real people about real issues. And I invited you on the show because I thought you might have some questions and you could represent a lot of the people out in the community. What questions do you have for Dr. Susie?
In terms of the emergency room, and again, such a pleasure to meet you. Thank you. I guess for me would be in terms of the emergency room, what are some tools that I can use to reiterate or implement to residents of the community with wanting to go to the community, with wanting to go to the emergency room, like not being afraid and things of that nature, because they feel if they don't have insurance, they shouldn't go.
Mm,
Oh,
yeah, that's too bad. I mean, well, yeah. So the emergency room, first of all, it's actually a federal law that
Mhm.
anybody who presents to the emergency room gets what they call a medical screening exam. Medical screening exam, though, doesn't just mean some doctor talks to you for 5 minutes to figure out if you're dying or not. It means
Right.
a medical screening exam means they have to make sure that your emergency situation is stabilized, which means that could be a CAT scan, that could be a EKG, blood work, all kinds of things, X-rays, etc. So first of all, anybody who goes to the emergency room gets seen in the emergency room. So you would
Right.
never be turned away from an emergency room. That's a really important thing.
Mhm.
And then another thing to think about. So I can imagine it's right. If you don't have insurance, it would be scary to go because yes, medical bills are high. Um,
Yes.
mm-hmm.
Big hospitals like mine, luckily, we have extra staff in the emergency room. We can actually hook you up with insurance. DC is good like that. DC has a pretty good system for that.
Mhm.
So we can connect people with insurance and then also connect people with things like sliding scale care, charity care, things like
Mhm.
that. So speaking up about stuff like that, if you're worried about it, to go for your medical problem, but also speak up and say, I'm worried about this situation, my situation with insurance. Yeah, that's sort of my thoughts. So first of all, please never be afraid. Please always come. That's
And
where I come down.
and then also with you mentioning like charity care or like
Yeah.
sliding fee scales, have
Yeah.
that been something that's been much more of an option since we've been in the pandemic? Like with going to the emergency room, may having to be admitted?
I don't think it really changed
Okay.
from the pandemic. Uh, I've never had to consider someone's insurance status when I'm trying to figure out if they need admission to the hospital. That's just never been something that ever crosses my mind. I
Mhm.
don't look at anybody's insurance information. It's not something that the hospital is like studying before they figure out if they're going to admit you to the hospital. So I
Okay.
can't say that like any programs have changed that I know of. You know what I
Okay.
mean? But the emergency room, we're a little insulated. Like we can do anything we want in the emergency room because it's an emergency. um,
Right.
so I'm a little insulated from that, from having to worry about that. But yeah, so no, I don't know that it's changed, but I do know that there's help available. Still,
Okay.
Deandra, are you hearing this in the community that people are afraid to go to the emergency room because they might have to pay, or what's
So
motivating
I
your question?
I guess what I hear more of is like what people health history is. So like if they may be asthmatic or have some form of like respiratory issues and they may need to be put on different forms of monitoring and stuff like that, that they don't want to accumulate a bill
right.
because they don't want to be within further debt. So some
Mm.
things they just figure, well, I just see if I can get an inhaler, or I would just use what is the one when you blow in the
Oh,
ball?
their
Oh,
incentive
the incentive
barometer.
surrounder, yeah.
Yes. So if they may have that from a past emergency visit, they would just keep doing that and then let like get into a telemed visit and let their provider know, what's going on, if they can see a provider or they could go to an urgent care or a minute clinic like at CVS. So they try to, do what they can do according to their budget. And it's unfortunate because it's like, when do we start allowing ourselves to have barriers to care based on our budget?
Mm-hmm. Mm-hmm.
And that's not fair, but these are questions that's being asked frequently. A personal question. So I recently had to go to urgent care. I know it's not ER, but urgent care, and I had symptoms that could have been related to possible being positive for corona, and they did give me a rapid test and it was negative, but they never asked me if I had the vaccine or if they had the vaccine and I was negative, could they offer it to me?
Right.
And I did have both of mine, but they just never, asked me or gave any information or educated me on the importance of needing to be vaccinated.
Yeah, that's a shame. And I don't think there's a real, I don't want to get into like how America's working the vaccine distribution, but I have to agree with you. I don't think looking at the big picture, like I don't think that my wish is that every corner would be a vaccine distribution center. You know what I mean? And just you walk by like, hey, I mean, the vaccine is exceedingly safe. Like 11 people out of a million have like even any kind of issue with it. Right? 11 people out of a million. Like, why can't you just be walking by? Hello, would you like a vaccine? You know? Well, yes, I would. Well, great. Here is one. Here's a card. Come back in 3 weeks. I'll see you right here on the same place. Like, that's how I would love to see the vaccine roll out. But instead, it's been very cautious, very careful. So, like, urgent cares aren't doing it yet. Why not? You know, like, it would be great for, you know, every place to be doing it. So, yeah, you know, everybody needs to get on board. But I think, frankly, it's not open enough yet. Like, we don't have the places to send people. Like, we don't have enough, like, easy places to send people. It'd be great. You walk in, you get your brochure. Hey, don't forget, go get your COVID vaccine. Like, and it's just not, it's so hard. You got to register for the vaccine. You got to put in all your information. You got to go on the right web. You know, it's still just hard to get it.
Do you think vaccine should be given in the ER, Dr. Susie?
Good question.
You got enough to do already. I mean,
yeah, I mean, we've thought about that in the past. We've thought about it with flu vaccine too, right? And the part of the trouble is like building the infrastructure for like MedStar does give the vaccine, and the infrastructure for it's really complicated, and we still do have to track everybody. And when are they going to come back in 21 days? And where are they going to come back? And when's that appointment going to be? So we have the infrastructure in the hospital. And we just now have the capability of putting in just a random order in the emergency in the electronic record that says, hey, that sends a message to the vaccine people saying, hey, this person's interested in vaccine. Can you reach out? So we just have that now at MedStar, which is great. To bring the whole like apparatus into the emergency room is complicated, and also we worry always about like people being like, awesome, emergency room's the place to get a vaccine. And now we're overcrowded, and then we bring in another 100 people a day who are just psyched to get the vaccine. So honestly, it's a little bit of like, yes, when I want to be vaccinated, we can't really do it in the emergency room.
Okay.
You see what I mean? So yeah, that would be great. And if there wasn't that whole infrastructure required, but at the place we're at now with vaccines, we still have to like everyone's being kept, you know, keeping track so carefully, and you got to come back for the 3 week. That's a big.
Yeah. So Deandra, you have one more question for Dr. Susie?
Yes. So just based on what you've dealt with the ER prior to pandemic, and now we're a year in the pandemic, where's the stress level?
Like where should everybody's be, or where's mine?
Where is yours?
Like mine.
Yes. Yeah. Like, oh gosh, I know you see a lot.
Yeah. Particularly, I'm at Washington Hospital Center. We're seeing a big proportion of the COVID patients, big proportion. My stress level is lower because our numbers are lower, and we have all our systems in place now. Like nobody freaks out if a patient might have COVID. We all know what to do. You know, we know all the things. We know what to do. We know where to put them. We know the test to get. So we know what to do. So that's all good. But the thing I actually stress about is that we're losing our, we're losing some of our cautiousness. It used, so somebody comes in, they might have COVID. Well, everyone would, and we were getting all of our PPE. Like, everyone, quick, get dressed, fully dressed. And now we're like, they don't look so bad. They probably don't have it. I think people aren't saying that, but just in their subconscious, we are bolder. We have our vaccinations, and I just worry that actually our vigilance isn't quite high enough. I think we're getting real comfortable.
Is there
it's right, but it's not right.
Okay, one quick question for you, Dr. Susie. Is there like any websites that's like easy information that I can provide to some of my counterparts or colleagues within the community, or even some of the residents in the community, how important this is, like with really taking it serious? Luckily enough, I got a lot of my friends to go get their vaccine, and my husband and stuff like that. I've completed mine. I wasn't trusting at first, and I've actually survived COVID myself from the summer.
Wow.
And it was terrible. I had pneumonia. It was very hard on me, but I had to do what was best to protect me again and my family. But is there anywhere I can go where I can at least reiterate this to them from a physician's perspective or a nurse perspective,
right,
and they can really understand how serious this is and how important, because people don't believe it.
Yeah, isn't that amazing? regardless of like hearing from people like you who've gone through it, I think first of all, it's so important that that person-to-person contact and explanation and sharing of experiences is like, first of all, I think the most persuasive thing possible. So I'm really glad you're doing it, because there's something about things on the internet or handwritten, that it's sure it has a lot of facts on it, but like it's hard to trust it. There's something about it. It's hard for people to trust because they don't, they're not 100% sure where exactly did that come from,
Yep.
So I'll have to be honest, like the places that I frequent, of course, are our Washington Hospital Center website. That's where I look every single day.
Okay.
So that's always one to go to. The CDC, it's they've got some of the, right. Well, right. And they have to clean it up now, right? Because it was kind of potentially a little shady there for a while. Well, not shady, but there was a lot of good information and some extra information that nobody needed to see, I think.
And it depends on what you're looking for, because when you go to these government websites, you really have to dig, and sometimes you can't find the exact answer to your question.
Yeah, that's the thing.
Which is why we have shows like this.
Right.
Exactly.
It's not like front facing. I totally agree with you. Even sometimes in the MedStar one, you have to click around, and I'm like, can everybody do these 6 clicks?
But that's what become disturbing. Like, people just want the answer right away. Because I recently got my 2nd dose, and I was there, and the people that was speaking, I don't know if they reached out to you, Dr. Lisa, about this, but the gentleman, right, he was screaming to everybody that was online to get their vaccine, and he was like, "And let me remind you, this is not FDA approved." And I was like,
a bystander, like an interested bystander trying to help people?
No, he was a part of the pharmacy, I guess, who was like a vaccine administrator, or just, I don't know. But I'm like, oh gosh. And then you got people that's over 65, and they're like, what?
And I'm glad you're bringing this up, because it comes up a lot. The emergency use authorization is essentially an approval, but it is for this exact moment. So we are in a pandemic, and the FDA has such a bureaucratic process. Like, to get something approved through the FDA, and you do all the paperwork steps and so on, it takes a really long time. And so the purpose of the emergency use authorization is to look at things and see if they're working, are they safe? And it allows you to skip some of that bureaucracy. And so essentially it is an approval. It's just a different mechanism to get things out after they've been shown to be safe. And so I'm really glad you brought that up.
Yeah.
That leads me to the other questions that are in the chat for you, Dr. Susie. And they are also related to COVID. COVID's on everybody's mind right now.
Oh, God, yes.
So the first one is, and I'll just tell you both, because we're winding down our time together. After you get, after receiving the COVID vaccine, can you still contract COVID? And then the other question is about reassurance. So someone has high blood pressure, arthritis, and bronchitis, 60 years old, and she wants some encouragement because she's afraid. I'm assuming it doesn't say specifically about taking the vaccine, but I'm assuming that's what this is. So Letitia, if you're still watching, you might add, in case that's not your question, please add additional information to make sure we're answering the question. So can you contract COVID after you've had the vaccine?
Yeah. So you can still get COVID after you've had the vaccine. It's a very, very small risk. I mean, they're finding it's sort of in the, maybe there's a 3 to 5% chance you're going to get COVID after the vaccine. I think the thing to focus on that I think is such a, I want to say game changer. It's such a profound piece, is that you may get it. Small chance you'll get it. But if you do get it, you're not going to end up in the hospital, and you're not going to die. I mean,
and that's all the vaccines, J&J, Moderna, all of them, right?
Right. So, I mean, to me, that's what, again, it comes down to this point, like, well, there's so many things to consider, but then you get down to, well, you're going to guarantee me that I'm not going to be hospitalized or die? Like, I'll take that guarantee. You know what I mean? Like, I'll take it. One day of body aches and arms sore and chills compared to like a guarantee that I'm not going to, I think it's a good bargain. So yes, there's a chance you get it, but the game changer is that you're not going to be in the hospital and you're not going to die.
That's good.
Yeah. And if someone's asking, Mabel is asking, if you've never tested for COVID-19, should you get the vaccine outright? And I'm not exactly sure what the concern is, because getting tested for COVID is looking to see if you actually have an infection. And getting the vaccine is to prevent you from getting the infection. So also, Mabel, if you're still here, you might want to clarify, but Dr. Susie, any thoughts?
Well, it might tag into the one where the person said, that they already had COVID, something. Anyway, so I wonder if she's thinking about, there is a test that can tell you if you ever had COVID. So she didn't get tested to know. Anyway, so say you don't know, maybe you thought you had COVID 6 months ago when you had a sniffles, or maybe you think, maybe I had mild COVID. So first of all, if you've ever had COVID, yes, you should still get the vaccine. We think there's somebody who asked, after COVID, you cannot contract it. So we know from the data we have so far that once you have COVID, we think the immunity to it lasts at least 90 days, at least. And there's some studies that are showing that it may be very long, years and years of protection from having COVID. But the vaccine can't hurt, might help, right? So it can't hurt you. If you've already had COVID, it can't hurt you to get the vaccine at all. Your immune system's already immune to it, but it will see the vaccine and be like, meh, I'm already ready. Your immune system's not going to go crazy or anything. And some people are having that long haul COVID. Like some people are having those kind of like COVID. I don't know if you had this at all, Deandra, but like kind of long term, like feeling tired, feeling this intermittent shortness of breath. It's so common. And some people are finding that when they get the vaccine, there's something about the immune system that it calms down those long term symptoms. So vaccinate.
Yeah. Oh, so Letitia has given us more information. I don't want to die, and I'm afraid that if I don't get it, it might increase my chances of not surviving the vaccine. So she wants reassurance. Letitia, I would just tell you, since you are someone who has chronic health conditions which place you at risk for severe COVID, meaning you could be hospitalized or even die from COVID, getting the vaccine is a good idea for you, because as Dr. Susie's already said, all of these vaccines, no matter which one you get, J&J, Pfizer, or Moderna, have been shown to keep people out of the hospital, particularly the ICU, and it prevents death. So the best option is to get the vaccine.
Yeah, and so I think, one thing you're concerned about, Letitia, is that if you have the high blood pressure and the bronchitis and things, does that make you at risk? Like, is the vaccine going to cause you to get sick? And absolutely it will not. Those things do not affect your response to the vaccine.
Yeah.
So it's very safe.
All right. And then our final question here from the listening audience is, how long should you wait if you get COVID 1 week after the first dose of the vaccine to take the second dose? And I'll just say, please don't think that the dose of the vaccine gave you COVID. The vaccines, it's not possible for the vaccines to give you COVID. They are to prevent COVID, and there's no COVID or no coronavirus in the vaccines. So it is a good idea if you have COVID after you get the vaccine, it's probably because you were already on the way to being sick. You were already infected, and it just happens to be showing up when you got the first dose of the vaccine. And by the time because you usually have to wait either 3 or 4 weeks if you have to get a second dose. And you should be over your COVID episode by the time your second dose rolls around. So, Dr. Susie, we could just keep you here all night answering questions about COVID and the ER. But I just have one more question for you related to the ER, and then I have a fun question. Why does it take so long to be seen when you go to the ER?
I knew this was coming. It's a thing about the ER that's so miserable. I think, first of all, when you come to the emergency, I think one thing to remember, when you come to the emergency room, you're worried, you're sick, you're uncomfortable, you're miserable. So every minute feels like an hour. That being said, people do wait a long time in the emergency room. There is no way around it. And it's for a couple reasons. One is that the emergency room sees a wide range of emergencies. And some emergencies, if someone has an emergency where their life is literally like about to end, then that takes up time and energy and people, and then you're waiting. If you're so that's triage, meaning we see the sickest patients first. And that's frustrating. You come in and you see somebody else go ahead of you and you're thinking, well, wait a minute, I'm waiting longer than that person, but we look similarly. It's really hard to tell by looking how sick somebody is. So that's one piece of it. Another thing is that, like I think I mentioned at the end, like, so anybody who comes to the emergency room gets seen, right? Absolutely anybody. And so what we do is we have staff for the kind of like the average number of people we get. That's how we staff, like, well, we expect this many people. And then some days we get 60 more people a day than we expect. And each person has a 4-hour visit or so, 3 hours, 4 hours, depending if you need blood work and stuff like that. So you can come on in, but we got to see every single person who's here. And it's not like a doctor's office where we know we have 4 people coming in this hour and then 4 people coming in the next hour. We can process through X number of people easily, and then more people than that make you wait. So we try to figure that out. We try to hit the sweet spot and make sure we have enough people to see enough people. But waiting is sort of a built-in thing. And testing, like if you get a lab test, it takes like an hour and 30 minutes to come back. Well, then you're waiting for an hour and 30 minutes. Well, but you got a test in that time. But it's still waiting. You're just sitting there. You're not doing anything. You're bored out of your mind. God forbid your phone charge dies. You know what I mean? It's like worse. So I think waiting on testing takes a certain amount of time. And when you're the one waiting on the test results, it feels like forever. And it's too long to wait. So I'm not going to say people don't wait in the emergency room. That is 100% true. And it's for a million different reasons. And I wish it weren't the case.
Yeah. Well, Dr. Susie, we're going to let you go, but not before you tell people how you became obsessed with hockey.
Oh,
I know you're a huge hockey fan. So tell us all about that, and then we'll let you go.
Oh, that's funny. I'm a huge hockey fan, and I actually work for the Caps, the Washington Capitals. So they have to have 5 kinds of doctors at every game: a sports medicine specialist, an orthopedist, a dentist, an eye specialist, and an emergency doctor.
Wow.
Yeah, is that interesting?
I never knew that.
Yeah. And
so how did you get chosen to be the hockey doctor?
Because I know the people who start contracts with the Capitals, number one. And then of course the person who organizes the emergency doctors is an emergency doctor. So they know me and they know that I'm a huge hockey fan. And that's how it happened. So I love doing it. It's a great gig, except, I'm just, my role is true emergencies, like God forbid a heart emergency or a breathing emergency. So we're always, it's fun because I go to the games, etc. But on the other hand, like you have to be prepared for sort of the worst possible. So that's what that is. So anyway, but the reason I became obsessed with hockey is because I have 2 children who both played hockey. And I drove to that rink. I've driven to those rinks 5,000 times, and that's where my obsession with it. It's a family thing.
And you don't have to say the Caps, but who is your favorite hockey team?
Oh, the Caps. There's nothing interesting there. Caps.
Gotcha. All right. Well, thanks so much, Dr. Susie, and for everybody who tuned in. We're signing off. This is Straight Talk with Dr. Lisa, and we will see you next week.